Hello everyone, my name is Carol Kate. I am here today to share with you guys what to bring to clinicals. Somebody who commented on my YouTube video for the nursing school supplies that will help you improve in nursing school. Somebody asked for me, was it the other video? One of my two videos. Somebody asked for help in what to bring to clinicals. Therefore, today I will share with you guys what I usually bring in clinicals, and so I'm going to start off by bringing my backpack. I'm showing you my backpack that I bring to school. This is it. It's black. It has colors in it. It's really good because it can get dirty wherever. You know, some nurses will just tell you to stick your backpack anywhere on their desks or in their staff room. Usually their staff room will already be packed with the nurses and the CNA's belongings. Therefore you're basically just going to leave your backpack under the table or somewhere on top of some bins in their break room or not. So that reminds me, don't bring anything that's very expensive. Don't bring your laptops or iPads. I mean, that's just what my teachers have told us, and that's something that we as students just have learned. And even the nurses will tell us that sometimes things can go missing, so that's just what I'm telling you guys in advice. And I know that clinicals can be very exciting, especially if it's your first time. It's kind of nerve-wracking as well. I've been having clinicals for at least a year now, and it's a very great experience. You know, just have a great attitude. Honestly, some nurses will be way more than welcome to teach you everything and let you try out everything, and sometimes you'll just be assigned with a nurse that won't really let you touch any of their patients' things, and that's fine because everything that you do will be basically under their license. But one advice to you guys is if you feel like jumping into something, you know, ask them if you can help them, and always be kind and always be helpful. If a patient just is asking for a cup of ice and water, I'm pretty sure you can go to the nutrition room and get that for the nurse. That's just one of the things that you can help her with, because first of all, you should be thankful that this hospital is letting you observe and letting you get hands-on. So that's just, I'm just letting you guys know that, because there will be some good days and there will be some bad days, good and bad days for the nurse and for you. But other than that, you're there to learn, and every day is a learning process. Okay, guys? So first of all, for those that haven't been to the clinicals yet, your clinical instructor, your CI, might make you look up some drugs first. First of all, your first drug pass or medication pass, it's going to be with your clinical instructor. I'm pretty sure most schools do that. They just want to see that you can give medication in the right way. So have your medication book with you, your drug book with you, because most clinical instructors will make you look up the drug before you give it to the patient. For me, for example, in my first block, every drug that we gave, we had to have a flashcard for it. So when we get there, my clinical instructor will ask the nurse that I'm assigned with if it's okay that I can pass some medications with my clinical instructor, and because she's gonna, you know, observe and kind of judge and how I do it, and if I do it correctly, you know. So my clinical instructor expected me to have a note card for every drug that I gave, and mind you, some patients have at least 20 drugs, so I had to search those and know about those drugs, side effects, classification, what nursing interventions would you look out for, you know, what to be careful on after you give that drug and what you would teach the patient. So you're going to need your drug book for that, okay? And I just want to explain that to you guys. So have your drug book. And sometimes I leave little markers there. Oops, it's a cough. Just in case there's a drug that, you know, you need to take a mark on. Another thing is in clinicals, of course, it's going to be a busy day. There will be times when it might be slow though, depending on where you are. Maybe you're just in labor and delivery or antepartum before somebody gives birth, and sometimes you might have to do so. You're going to be running around all day, or sometimes you might have 10 minutes or 30 minutes just kind of waiting for something to happen. I don't know. So what I usually do is I bring some books. This is like an assessment book. Like, let's say if you're at the very start of nursing school, you're going to want to learn on what to assess your patient with. But you could still bring this towards the end of the school year, even if you're almost done with nursing school. You always want to know on what you can do to assess your patient and, you know, the normals and abnormals, okay? So those are one of the books that you might always want to carry on, assessment book. And also nursing care planning. I mean, some people might be really pro, some teachers, I mean, you're going to have a different clinical instructor for your med-surg, maybe. You're going to have a different clinical instructor for your OB portion. You're going to have a different clinical instructor for your critical care portion of in your nursing program. Therefore, they're going to make you want to do a lot of care plans, probably. Some teachers might just want one. Some teachers might want every patient to have a care plan. Therefore, bring this book just to be more sure. Another one is, I just finished my pediatric nursing last week, so I got this pediatric nursing, and sometimes you can sit there and answer some NCLEX questions, and that can help you for your theory exam too. Okay, so if I'm doing my peds clinical right now, I'm gonna want to study for my peds test that's coming up in about 3 days or 7 days. So you know, that this is good, but mind it, you're not going to always want to sit there and look like you're just at the desk. You're going to want to represent, you're going to want to volunteer to help your nurse, but know what you can do and know what you can't do, meaning like maybe your school won't let you do IVs yet, or maybe your school won't let you do IV bolus medications yet. You know, just know what your nursing program lets you do or not. Okay? So I'm going to put these books aside. And of course you're going to need a black pen, because a black pen is necessary for anything you're going to want to document, or another thing is to have a mini notepad, because some clinical instructors will come up to you in the middle of the day and they'll be like, hey, how's your day going? Tell me about your patients. How many patients do you have? And I'll be like, I have 3 patients. And I'll be like, okay, tell me a little bit about them. And you're gonna, of course you're gonna want to try to remember, but also you can be over here, okay, that one patient's diagnosed with pneumonia, the other one has this and that, this is what they're trying to do as treatment right now, and this is something that I learned that I didn't know about before. You know, just cool things that you want to write down too, things that you know and things that you don't know. Okay, so have this ready with you. And also sometimes some nurses might want you to help them with something, and you're going to need to list all of those commands down, right? So it never hurts to have a notebook with you. It's a little one. See? And I think I've shown you this in my other videos. Okay? So black pen. And of course, you're going to want a black Sharpie, because depending on what, if maybe you're in med surg, you're in the burn center, or you're going to be changing a lot of dressings, or you're going to be labeling some IV stuff. So have this ready with you, a permanent Sharpie, a skinny one, or whatever thickness of Sharpie you want, because you're going to be labeling a lot of things, okay? And of course, bandage scissors. I'm not gonna lie, I am pretty bad at always remembering to bring my bandage scissors, and it's not every clinical day that you need it. Again, you might need it to cut some pills open, because some pills are really hard to open, or you might need it to cut off some kind of bandage stuff, some dressings. Just trying to remember. Yeah. And another thing is, you're gonna want to bring your Penlight. I left my Penlight somewhere from my old clinical, so I'm gonna pass clinicals, therefore I need to buy new Penlight. It's good too, Penlights, because sometimes when you're there in clinical early, let's say if you're in a peds rotation, some kids are still sleeping and you don't want to wake them up, but you just go into their room to change, like, to check on their dialysis machines or something like that. You don't want to wake them up yet, or the nurses don't want to wake them up yet. So you're going to need a Penlight to see the surroundings around you. And just, you know, it's also good for, of course, your neuro assessment and your perla for the eyes. Okay, so bring your Penlight, guys. And where did it go? Oh, here it is. Also, just like a hospital tape. I'm pretty sure most hospitals have tape, but you just want to look like you are a handy dandy student, and some nurses might forget to grab some tape, so you definitely need this, you know, just to keep IVs in place, keep their, just to keep things intact, you know. I'm trying to think of ways where you need Band-Aids. Well, after you take somebody's IV out, you're gonna, different nurses have different techniques, but you're gonna want something like a gauze maybe to stick there, and then tape it on there to just keep pressure on their skin where the IV just came out from. So, you know, that's another thing. Just be a handy dandy student, okay? And of course, don't forget to bring your stethoscope, because I'm pretty sure your teacher's gonna want you to make so much assessments. My first block teacher, she said, okay, you don't have to do a whole nursing plan and care for your patients today, but I want you to do 10 assessments. So you're gonna want to listen to their heart, to their lungs. Are they clear? Are they bilateral? Are they symmetrical? You know, do they sound alike? Are there any heart murmurs that you hear? Of course, listen to the bowel sounds. You know, in the stomach, is it active? Is it hyperactive? Is it hypoactive? So have your stethoscope. This is mine. Of course, it's a Littmann. It's a dark blue or navy blue, and this is the box. And so far it's really good. I bought it for $89.99 at some kind of scrub store, and they didn't offer discounts for Littmann's at all, and I think it's because it's a good brand of stethoscope. So have your stethoscope with you guys. And then another thing is, there's this like nurse assist board that my mom got me, but I still haven't used it. But it has a bunch of like, it's like a clipboard, which is nice because you're probably gonna have a lot of papers as a student from school or from the hospital that they give you, and it just has a bunch of like pain stuff and like things that you should have in it. And it has a little calculator right here. That's another thing, guys. Bring a calculator, because just to make sure, because some nurses like to ask you if you know, double check if you know your math or not, your medication conversions or not. So have a calculator ready. You never want to make a med error, okay? And so this one comes with a calculator on it, and it's a clipboard at the same time, so it's pretty nice. And it says here how to assess for edema, how to assess for pulse points, weight equivalence, pressure ulcer staging, and it has a little ruler on the side. So that's pretty awesome, right? Why not? I have yet to bring this. I just haven't, you know, really taken it out of its box yet. Of course, don't forget to bring your badge, because some school will want you to have your student badge all the time, and also the hospital, because they want to be sure that you're a student and no random strangers are in and out of their hospital. You know, they want their patients to be safe. They want their employees to be safe. So have your badge and your ID always ready and always on you, so people can call you by your name. People can know what school you're from. It's just one thing that everybody wants. And of course, I'm not gonna lie, I just get hungry sometimes, so I do bring K-bars or granola bars, and you're not gonna be eating this hopefully on the desk or something, but you know, if you go to the staff room to drink water, then you might as well take a bite of this, because you don't want to pass out. You don't want your stomach to have an ulcer from not eating or something. And some clinical instructors are very tight and sometimes you can't bring coffee to the nurse's station at all, even though the other nurses are doing it. Your teacher just won't let you do that, and some are okay with that, you know. And there's some teachers who won't even let you bring a bottle of water, but that's okay, because you want to look professional. I mean, you can't, I mean, when I say you can't bring a bottle of water, some clinical instructors don't want you to bring this bottle of water to the nursing station. So you're gonna have to leave this in a break room maybe, or maybe, yeah. Always bring bottled water though, okay? So that's that. Have a watch, because you're gonna be, you just need it all the time to have a watch. What? I'm trying to think that I'm like out of it. What do you need a watch for? Dang. I can't remember right now, guys. It's like 2 in the morning, but I'll come back to that. I'll put a thing in this. But yeah, you always want to watch, okay? It's either you're watching for like a gravity IV, make sure it's flowing at the right rate, making sure that it's dropping at the drips per minute are correct. Those are one of the things. Okay. I have these hand sanitizers from Bath and Body Works. There's a little string on it, even though everywhere in the hospital is probably going to have a hand sanitizer pump. But, you know, it really depends on how, you know, how great the hospital is, or, you know, how ready with supplies they are. But have your own, because you're going to want to be clean for your patients and for yourself. Okay? Hand sanitizer. And hand lotion, because you should be washing your hands frequently as well, and you don't want your hands to be dry too much, so have a hand lotion with you. Not too much. No, don't have strong smell though, because you don't want to make other people even more nauseous and feel more sick than they already feel, you know. And if you're a girl, have some pads or tampons with you, because even though some hospitals will have extra pads in the restroom, they might run out, and you don't want to have to go asking around. So bring your own, okay? So now just let me look through my bag. What else did I miss? maybe a little cardigan or a little jacket. Don't be chewing gum. First of all, be professional, be nice to everyone, and I think that's it. I'll just list some things that I've missed, but sorry I haven't made a lot of videos lately, and it's just been a back-to-back of all sorts of things, but thank you everyone for watching, and I wish you guys good luck. Thank you.